The treatment goal for diabetes is to maintain your cat's blood glucose concentration within an appropriate range throughout the day. Insulin is only part of the treatment plan. Nutrition also plays an important role. We will review 3 concepts important to dietary management: maintaining a consistent diet and feeding schedule, feeding to maintain a healthy, lean body weight, and selecting an appropriate type of cat food for diabetes. Diabetic cats need a consistent diet and feeding schedule. Changing the type of food and amount of food offered from meal to meal can lead to harmful fluctuations in your cat's blood glucose concentration. To avoid this, feed your cat the same amount at regular intervals each day. Your veterinarian will help you work out what type of food to feed, how much, and when to feed. Many cats diagnosed with diabetes are overweight. Obesity is not only a risk factor for the development of diabetes, it can also make managing a diabetic cat more difficult. Research shows that obesity leads to inadequate or insensitive insulin receptors, preventing cells from getting the glucose they need for energy. Reducing obesity helps to reverse this process, improving the response to insulin therapy. In fact, correcting obesity can sometimes eliminate a cat's need for insulin injections altogether. However, since cats are notoriously inactive, getting an overweight cat to lose weight can be challenging. Feeding a controlled amount of a specially formulated diet, which is low in calories, can help. If your cat is overweight, your veterinarian should recommend a prescription diet plan that allows for safe and controlled weight loss. You will need to weigh your cat often to monitor progress, but the health benefits are worth the time and effort. There are many different kinds of commercial cat foods for diabetic cats. Many of these are available by prescription from your veterinarian. Some of these foods are high in fiber. Fiber promotes weight loss by providing bulk without calories. Other foods are high in protein and low in carbohydrates. To understand how these diets help diabetic cats, let's look at what happens to food after your cat eats. During digestion, food particles are broken down in the stomach and intestine and absorbed into the bloodstream. High-protein foods undergo complex metabolic processes in the liver as they are slowly converted into glucose for energy. In contrast, high-carbohydrate foods are more rapidly converted into glucose, leading to larger increases in blood glucose concentrations after a meal. This increase in glucose can cause problems for diabetic cats. They don't have enough insulin and insulin receptors to handle the extra sugars. Some new prescription diets, formulated specifically for diabetic cats, take a high-protein, low-carbohydrate approach. Research suggests that these diets may slow glucose production, helping diabetic cats maintain a more optimal blood glucose concentration following meals. Once you and your veterinarian have selected a diet appropriate for your diabetic cat, introduce the new diet slowly over a period of 2 weeks. Not only are cats more likely to accept a new food when introduced gradually, but the diet change is also less likely to cause vomiting or diarrhea. Don't let your diabetic cat skip meals. If your cat doesn't like the new diet, work with your veterinarian to find a food your cat does like. Giving an insulin injection to a cat that hasn't eaten can lead to insulin shock. Food treats and table scraps are best avoided. They can raise your cat's glucose level, causing poor diabetic control. Feeding a prescription diet and following a careful feeding schedule requires some extra time and attention. However, the benefits to your cat's health will make it well worth the effort.